Many people today are in debt. This debt can be a major factor in ruining a person's health. Yet this debt has nothing to do with dollars and everything to do with dozing. Sleep debt develops when a person does not get the amount of healthful sleep needed for well-being. This can be caused voluntarily by a person's lifestyle, but often it's the result of an illness.
How do you function during the daytime? If there's a problem with what we consider excessive fatigue, if not sleepiness, then many times we're going to be interested in looking, is there a problem from the standpoint of a primary sleep disorder?
The medical community used to view the chronic inability to sleep as just one disorder, insomnia. That's changed. Doctors can now diagnose several categories of sleep disorders. One of the most common disorders is sleep apnea, which literally means no breath.
Sleep apnea is something that is always in the setting of severe snoring, but it's more than that. It is actually a breathing disorder in sleep. What happens in sleep apnea is literally the throat region is narrowing down and closing off, and because of that, you're not able to breathe adequately enough to maintain your sleep. It can lead to blood pressure problems because it affects your oxygen levels at night, and that affects your blood vessels in your heart. It can lead to an increased risk of heart attacks and strokes.
Pretty serious stuff. Just ask Gary Grover. Gary works here at the sleep clinic as a nurse practitioner, helping patients determine the cause of their sleep debt. But his first trip here was as a patient.
I had periods at night, I was told by my wife, where I snored very loudly and I stopped breathing. She actually counted the time frame of which I stopped breathing, and I had stopped breathing for over a minute.
That was all Gary needed to hear. After an evaluation at the sleep clinic, healthcare professionals determined that Gary needed to undergo a sleep study in order to find the cause of the problem.
Gary, you ready for a good night's sleep? I'll say good night.
Good night.
As the patient sleeps, or doesn't sleep as the case may be, technicians are measuring brainwave activity and breathing patterns, monitoring every movement, every heartbeat. By studying the results, they can determine if a patient falls into any of the categories of sleeping disorders, such as narcolepsy, sleep talking or sleepwalking, or even restless leg syndrome. The results of Gary's study? You guessed it, sleep apnea. There are several treatments available for sleep apnea, but Gary opted for the most effective non-surgical treatment, continuous positive airway pressure, or CPAP for short.
And the CPAP unit is nothing more than a small air compressor. And basically you just breathe through that device during the night.
The machine is not only helping Gary get a good night's sleep, it also has his wife, Catherine, breathing a sigh of relief.
My wife said I no longer snored. Daytime sleepiness went away. When I woke up in the morning, I felt refreshed. I felt good again. I didn't have the fatigue feeling. I felt like I was rested. It was like I have a lot, like I didn't have apnea anymore. And in fact, I did not.
With his sleep debt paid in full, Gary's now able to put this problem to rest. For Smart Medicine, I'm Rod Starnes.
Joining me now is Dr. Mark Hoffman. Dr. Hoffman, thanks so much for joining us.
Thank you.
Does everyone who comes in for a sleep evaluation end up needing a sleep study?
No, in the course of an interview, we can decide whether or not they have other issues that can be addressed that don't necessarily need a formal sleep study.
If you're having trouble sleeping, what are some of the things that you recommend?
What we usually recommend is keeping your room dark, quiet, cool, comfortable. Don't eat or drink alcohol a few hours before bedtime. And if you have problems where you're actually trying to sleep and can't get to sleep, get up and then come back to bed and restart.
Are adults the only ones who have sleep disorders?
No, sleep disorders can affect children, and they have a wide variety of manifestations that can occur from just feeling tired and being excessively sleepy to things along the lines of hyperactivity. Sleep apnea is a common problem that can affect children, and actually that may be implicated in hyperactivity. Also, disorders of the circadian clock or the body clock, such as night terrors and sleep disorders from that standpoint can
Tell me the difference between night terrors and nightmares.
Well, night terrors are usually disorders of confusion where it's arousal disorder, where children will wake up in the first third of the night screaming. They're confused, they're combative, they may not necessarily remember where they are or what's causing the problem. They're difficult to console, whereas nightmares, they wake up, they're usually awake and they can be consoled pretty easily, and they remember why they wake up.